Assalamualaikum and hi, I'm Nazrul Daim, and right now I'm doing something most of us do every single day, which is typing. Whether it's assignment, emails, or scrolling on your phone, your hands are constantly working. But have you ever stopped to think about what's happening inside your wrist when you do this? So what's actually happening inside your wrist when you type? Running down your forearm and into your hand is a nerve called the median nerve. This nerve is responsible for sensation in your thumb, index finger, middle finger, and half of your ring finger. And it controls the small muscles at the base of your thumb, called the thenar muscles, which you use to grip and pinch things. The median nerve passes through a narrow passageway at your wrist called the carpal tunnel. This tunnel is formed at the bottom by 8 small carpal bones, arranged in 2 rows. And the roof is a tough band of tissue called the flexor reticulum, sometimes called the transverse carpal ligament. Inside this tunnel, along with the median nerve, run 9 flexor tendons: the flexor digitorum superficialis, flexor digitorum profundus, and the flexor pollicis longus, the tendons that pull your finger downward when you type. Every time you flex and extend your fingers, the tendons move through the tunnel. The nervous system sends electrical signals down the median nerve to coordinate this movement with precision. The musculoskeletal system, specifically the intrinsic hand muscles, fine-tunes that movement for speed and accuracy. As you can see right now, my hand become numb due to typing. Now, imagine that tunnel gets too crowded. The synovial tissue around the tendons become inflamed, often due to repetitive hand and wrist use, like extended typing, and this swelling increases the pressure inside the tunnel. When that happens, the median nerve gets compressed. This is called carpal tunnel syndrome, or CTS, and it is the most common peripheral nerve compression disorder in the world. When the median nerve is compressed, you start to lose its normal function. The nerve fibers that carry sensory information get disrupted first, which is why the early symptoms are tingling and numbness in the thumb, index, and middle finger, especially at night or when you wake up in the morning. As compression weakness, it affects the motor fibers too. The thenar muscles begin to weaken, making it harder to grip objects or even type accurately. In severe cases, those muscles can visibly waste away, a sign that nerve damage is serious. So if you type for hours every day, your wrist posture, repetitive motion, and even the angle of your keyboard can all contribute to the pressure build-up. CTS makes typing the every activity I'm demonstrating painful, clumsy, and in severe cases impossible. So how do we diagnose and manage CTS? Let me show you 2 key things. First, there's the wrist plane. It works by holding the wrist in the natural position, roughly 0 degrees of flexion or extension. Why does this matter? Because the pressure inside the carpal tunnel is lowest when the wrist is in neutral. Any bending up or down raises that pressure and squeezes the nerve further. Wearing a splint at night prevents patients from unconsciously flexing their wrist during sleep, which is when many people's symptoms are worse. So the next time you sit down to type, remember there is a whole anatomical system at work in your wrist. The carpal tunnel, the median nerve, the flexor tendons, and the thenar muscles are all working together every single time you hit a key. Here are 3 things you can do right now to protect that system. 1. Keep your wrist in a neutral position when typing. Your wrist should float level with the keyboard, not bend up or down. 2. Take a break every 30 minutes. Shake out your hands, do some gentle wrist circles, and let those tendons and the synovial tissue decompress. 3. If you start experiencing numbness, tingling, or weakness in your hand, especially if it wakes you up at night, see a doctor early. CTS is highly treatable when caught early, but nerve damage from prolonged compression can be permanent. That's all. I'm Nazrul Daim. Thanks for watching. Don't forget to look after your hands.